I'm going to be talking about the effects of carbon monoxide poisoning on neurological function. The reason that I chose this topic was kind of driven by my experience at UNC Medical Center. I had a patient who was young, similar to my age, and was in a severe house fire and was kind of presenting with some interesting symptoms, neurological wise, and it kind of forced me to dig deeper in his medical chart and realized that some of these symptoms that we were seeing were the effect of carbon monoxide poisoning from that fire. So I thought it'd be interesting to kind of see what else that carbon monoxide poisoning can do to your neurological function. So according to the CDC, there's more than 20,000 emergency department visits per year that are related to carbon monoxide poisoning. Some of the causes are building fires, so like I said with my patient, industrial plants, vehicle exhaust, which can also unfortunately be used as a mode of suicide attempt, malfunctioning gas stoves, heating appliances or generators, kind of any of those inside exhaust mechanisms that are emitting carbon monoxide. Some acute symptoms of this carbon monoxide poisoning are headaches, dizziness, syncope, loss of consciousness, seizure, coma, and death. So the thing about carbon monoxide is it's called the silent killer, which is a tasteless, odorless gas, which makes it kind of difficult to determine the cause of these symptoms, because as you can imagine, headaches and dizziness can kind of mask as flu-like symptoms, and that's the concern with carbon monoxide. But with this poisoning, you can have some detrimental serious effects if it's not treated immediately, and sometimes even with treatment, you still have delayed neurological sequelae, which can develop in 40% of people within 2 to 40 days after those acute symptoms disappear. So I kind of want to go a little bit deeper into what happens at the cellular level. So it's a pretty complex mechanism, but what happens is that there's two detrimental effects on the red blood cell. So if we're thinking about a red blood cell, it's filled with a bunch of hemoglobin molecules, millions of them, and that are binding sites for oxygen. But when there's carbon monoxide poisoning, the carbon monoxide is entering the bloodstream and is sharing the same binding site as the oxygen. So that creates a less oxygen carrying capacity for this hemoglobin site. So if you can imagine a original heme group binding to 4 oxygens, then if carbon monoxide is taking up 2, it's half the amount of oxygen that you would normally have. And these heme sites have a much greater affinity for carbon monoxide, so they're more attracted to carbon monoxide than the oxygen. And then also on top of that, it creates a stronger affinity for oxygen as well, meaning that the hemoglobin is less likely to release the oxygen. So it's so attracted to the oxygen that it doesn't want to release it into the tissues, which, as you can imagine, is going to create detrimental effects because it turns into anemic anoxia, which it means that there's a significant amount of oxygen that's reaching the blood, but the amount of hemoglobin available for transport is just decreased. So what happens when there's less oxygen carrying capacity and the oxygen is not being released into the tissues, it creates ischemia or necrosis of those tissues, which is obviously going to result in an altering of the function of those structures. So typically, the structures that are going to be affected are the ones that need the most amount of oxygen, which typically is your heart and your brain. So for today's purposes, I'm going to talk about your brain and the neurological sequelae that result from this carbon monoxide poisoning. So some symptoms of delayed neurological sequelae are memory loss, movement disorders, Parkinsonism syndrome, communication impairments, depression, dementia, psychosis. So kind of a whole gamut of symptoms that can show up later after this acute poisoning. And then some of these specific deficits are difficulty concentrating or attention, memory impairments, emotional changes, stupor, coma, gait difficulty, and movement disorders. And then one way that they detect this this silent killer, the carbon monoxide poisoning, is by CT or MRI. So the problem is though is that the abnormalities, excuse me, were noted on initial CT only half the time. So I mean that's a 50-50 shot, but it's not the most reliable for detecting or most sensitive in detecting this type of poisoning, which is concerning. And the areas of damage that are most affected are usually the basal ganglia, specifically the globus pallidus, deep white matter, cerebral cortex, and hippocampal regions. So the question that I was raising was why the basal ganglia and the globus pallidus in these regions specifically. So they're not really sure why there's preferential effects on those areas. But they seem to think that the preference for CO binding to iron-rich structures is why they're kind of more attracted to that. So it'd be interesting to kind of research more information of why those structures specifically. So obviously there can be damage to numerous structures of the brain if oxygen is not being released into them. It can cause ischemia anywhere or necrosis, but for today's purpose I'm going to focus on the basal ganglia and the hippocampus, so kind of movement disorders and memory impairments. So as just kind of a review, the basal ganglia includes the caudate nucleus, the putamen, the nucleus accumbens, the globus pallidus, the subthalamic nucleus, and the substantia nigra. The basal ganglia has an effect on motor function. So the input is fed into the thalamus and then to the cortex or the brainstem, and then can facilitate the initiation of movement or executing movement or terminating movement. So basal ganglia is really involved in those movements. Lesions to the basal ganglia can produce two major types of movement disorders: poverty of movement and excessive involuntary movement. Also, damage to these structures can result in fine motor control, difficulty with fine motor control, and the efficiency and coordination of movement. So, as you can imagine, that can kind of surface in many different ways. And the most pertinent way that we can think as speech-language pathologists are in your speech and swallowing. Those are the two main things that are of concern right now, and seeing patients with voice disorders and affecting their fluidity of speech, maybe presenting as dysarthria or those types of things is what's it going to look like in basal ganglia damage. And then also too, there can be damage to the hippocampus with this lack of oxygen transport. And as we know, the hippocampus plays a role in the formation of new memories, specifically episodic, so kind of different events, and then declarative memory, so for example, facts. Damage to the hippocampus can result in long-term memory deficit. So I was reading a bunch of articles that talked about amnesia in these patients with carbon monoxide poisoning. So they're they aren't able to retain or form new memories. And then it kind of is under the hippocampus is really involved in recalling specific personal experiences and memories for sequences of events, which, as you can imagine, can play a big role in your daily functioning. Remembering to take your medications and remembering events from your life is a pretty pertinent factor that we want to address as SLPs. So kind of transitioning over to treatment implications. For these patients with memory impairments due to that hippocampus damage, we can provide some compensatory strategies. So we can provide an orientation notebook, an electronic device, setting alarms, memory notebook to maybe, this is a picture of your wife, and providing kind of cues for that, and then using techniques like error-less learning that we learned about in Dr. Lundgren's class in the first year of graduate school, spaced retrieval, and then just doing some memory strategy training, so visual verbal associations and elaborations like mnemonics, storytelling, those types of things to kind of aid with compensating for that memory loss that's going to occur. And then movement disorders. So with my specific patient, this was manifesting as Parkinsonism, which is kind of a blanket term for neurological conditions that present similar to Parkinson's. So with movement disorders, tremors, hypokinesia, those types of things. So what we can do as SLPs is we can provide treatment to address dysarthria, dysphagia, voice disorders, and kind of getting involved with providing an AAC device to facilitate communication, and maybe doing LSVT or pitch limiting voice treatment, and using pacing boards, and dysphagia treatment, so exercises and compensatory strategies. So kind of a whole gamut of things that we can provide as far as memory impairments, and then also in the movement disorders, which are, I think it's something that might become more and more prevalent, or maybe because it's not always identified by CT or MRIs, we might not always know that carbon monoxide is for sure the cause of these, but we can understand that there's ways to treat the symptoms that are coming about from carbon monoxide poisoning. So I hope you learned a little bit more today about carbon monoxide poisoning and the silent killer, and thanks for listening.